Donald Trump shuts down the FDA, the CDC, and NIH from communicating openly to the public. I'm Dr. Hassan. There's been a lot of medical updates so far in the first 3 days of his administration. Let's get into it. Starting off just 2 days ago, Donald Trump and his administration told the NIH, CDC, and the FDA to pause all communications. This means they cannot send out health alerts, they can't send out guidance, they can't really impact public health in any way. Number two, the administration actually paused all new NIH grants. So basically academic institutions across the country and academic physicians and academic medical practitioners cannot apply for grants. Number three, he actually rescinded the Biden order for Medicare pricing of certain medications. Now, what are my thoughts on this situation? Starting off with first and foremost, pausing the communications from the CDC, the FDA, and the NIH, as well as pulling out from the WHO. It's a bit concerning. Why? Because in medicine, just like any other profession, you need to have some sort of central body you can kind of turn to for guidance. Pausing it for a few weeks or a month or a couple months, not a big deal, but shutting it down completely is going to be catastrophic. Number two, when we talk about the NIH grants, this is going to be a big problem for academic institutions. Previously, a lot of these institutions, they get NIH grants for studies and those kind of things, and they can use that money to kind of fund their hospitals. As a physician, I've seen a lot of interesting NIH studies that probably don't need to be funded. But with that being said, the majority of the research that's done is for the betterment of humanity. So a little bit more nuance in the way they select their projects, probably okay. Taking it away completely is going to be catastrophic for academic institutions. That means anybody looking for cutting edge care or anybody who's of the lower economic status looking for academic care, it might be gone in the next 3 to 5 years if they get rid of all the NIH funding. Pulling out from the WHO is a big mistake. WHO kind of represents the entire world. The world's health is kind of the doctor for the whole world. Not having a central body to turn to for the entire world, especially in a time of, global crises, probably a bad idea. Changing the way medications are negotiated and medical pricing, it's a good idea in thought, but the target is kind of wrong. The target should be the pharmacy benefit managers, and pharmacy benefit managers should not be owned by insurance companies. That makes absolutely no sense. So he is doing some positive things with all the AI infrastructure in healthcare, but there are a certain amount of negative things that have caught my eye. What do you guys think? Leave me a comment below. Should we be part of WHO? Should they pause NIH funding? And should we get rid of academic hospitals? I love you guys. I'll see you on the next one.